What to expect from COVID-19 this winter is coming. Again. A year ago, experts warned that the United States faced a grim winter if Americans didn't mask up and social distance to slow transmission of the SARS-CoV-2 virus before indoor weather, aka winter, settled in for its long stay. We all know how well that warning was heeded. In January, cases topped 300,000 a day. COVID ended the lives of about 95,000 Americans before the month was out. Now indoor weather again looms in many parts of this country, and daily case counts are rising well into the six figures. The highly transmissible Delta variant is driving spread, even among fully vaccinated people. Children are back in classrooms that can function as germ incubators. As you walk around in public, you see noses poking out of masks, masks under chins, faces that are mask-free.
So what should we expect as we head into our second COVID autumn and winter? The bottom line is, I think, uncertainty, said Jeffrey Dutchin, health officer for the Seattle and King County Public Health Department, who has been mired in the COVID response since the earliest days of the U.S. outbreak. We are experiencing a new virus, a newly emerged pathogen, and we're trying to fight it with new tools that we don't have a lot of experience with, he said. And we're dealing with unpredictable human behavior, which is a very important factor as well, and environmental factors that may influence the severity of COVID outbreaks and how well it transmits. There's a lot of moving parts, said Dutchin, who is also an infectious diseases professor at the University of Washington. Among them, the questions of when COVID vaccines will be approved for use in children and what percentage of parents will agree to vaccinate their kids. While the crystal ball may be cloudy, who can resist taking a peek? Let's talk about some things we might face in the months ahead. The high crests of Delta transmission are subsiding in some parts of the country, as they have in countries where Delta took off before it did in the U.S. Cecile Vibaud, an infectious diseases epidemiologist at the National Institutes of Health's Fogarty International Center, said 9 modeling efforts her group is monitoring suggest that by the end of November, the Delta wave will have waned and new cases will be down at quite a low level. How low? Down to where the country was in late June and early July, before Delta took off. At that point, the country was reporting somewhere between 7,500 to 15,000 new cases most days. Sounds heavenly, doesn't it? So does what Vibaud said next. We're probably going to stay there, because there is quite a bit of immunity in the population, she told StatDoc. That heartening prediction comes with a big but. That assumes that no new variant comes in. Because if you get a new variant that either has a higher transmissibility or immune escape potential, then we will see a resurgence. Late November coincides with Thanksgiving, America's favorite week for cross-country travel. Last year, Thanksgiving and Christmas turbocharged COVID spread. Can transmission levels remain low if large family gatherings occur across the nation this year? Vibaud said all the models factor in events like Thanksgiving. The expectation of low transmission by around that time is predicated on the amount of immunity there will be by then in the country, antibodies generated by vaccination. 63.9% of eligible Americans are fully vaccinated or acquired the hard way through COVID infection. Trevor Bedford, a computational biologist at the Fred Hutchinson Cancer Research Center in Seattle, thinks the massive summer wave the country has been experiencing will have taken some of the loft out of the balloon when it comes to fall and winter spread. By crashing over the country in the summer, Delta pulled forward in time some infections that otherwise would have occurred later, he said. It is likely that we'll see some wave, Bedford said. I would like to think it's very unlikely to be as big as it was last year. The World Health Organization's top coronavirus expert is less hopeful in her prognostication. Maria Van Kerkhove thinks people are making the mistake of trying to interpret SARS-2's behavior and predict its path by looking through the prism of influenza. SARS-2 may one day behave much more like that seasonal scourge, which causes a wave of illness in winter months in temperate climes, but it's not there now, she said. I feel that a lot of people want it so badly to behave like flu. So that we can get into this pattern of, okay, in the summer, everybody can relax. And then, we just need to gear up for the fall. We need to get the vaccines underway. Get people vaccinated and just ride it out through that peak, that winter peak, Van Kerkhove said. But I don't see that in the data that we have. She believes human behavior, whether that's wearing masks, social distancing, or getting vaccinated, has much more to do with declines of COVID transmission still than built-up immunity. The Delta variant hasn't run through all the unprotected people, she insisted. Delta still has a lot more energy in it, Van Kerkhove said. I think we should expect more ups and downs. I think we should expect more peaks and troughs. I think the peaks could become less. Potentially. But I think those peaks will be very sharp in specific populations like unvaccinated, unprotected populations. That should be expected. As people's immune systems have acquired experience grappling with SARS-2, again, via vaccine or infection, deaths as a percentage of overall cases have declined. That trend will hopefully continue. It's not clear how long immunity lasts following infection. It can be pretty transient with human coronaviruses, but so far there haven't been huge numbers of people reporting their second or third case of COVID. We're going to learn how long infection-induced protection lasts as time goes on, as well as how long protection lasts after vaccination. When immunity levels in communities start to subside, that could trigger a new resurgence of cases, Vivad said, but she added the expectation is that with further waves of cases, hospitalization and deaths will not resemble the earlier waves of COVID. Bedford agreed. You could also imagine a large COVID wave this fall-winter, but with much lower morbidity and mortality than it was last year, he said, noting that it seems almost certain that the infection fatality rate, the percentage of infected people who died from the disease, will remain lower than it was earlier in the pandemic.
Thank you for watching. Please subscribe.